we re-recorded?
You're on.
Awesome, I'm on. Okay, so Precious had x-rays today for a limp in the left hind limb. She has two things going on in her body. The one that I think is causing her pain is her left knee. She's torn what's the equivalent of ACL. So in dogs we call it a CCL, cranial cruciate ligament. She also has in her lumbar spine, so this is an x-ray of her laying on her side with her right side down. Between the first and second lumbar vertebrae, she's just got a bulging disc. And that can create back pain, which can intensify a lameness in the back end. I think the reason why she's more painful, though, on that left hind has to do with her ligament and the instability. So when I'm looking at the bulging disc, though, and we'll kind of zoom in here. This is the side view of her spine. This is lumbar vertebrae number 1 and number 2. We can see this little white calcification. This is the disc space. The discs are the cushions in between the vertebrae. Hers has calcified and it's kind of putting pressure on her back. So that's something to keep in mind. We really want to try and limit her jumping. And if you ever notice if she's vocalizing or crying in pain, I think that will probably have more to do with the back and less to do with the knee. And there's medicine that we can give her to help her with this. The knee x-rays I'll go over next. I'm going to show you a comparison and contrasting x-ray. So we can look at her normal side versus her abnormal side. Okay, so as we zoom in, the left is on the left-hand side of the screen, and the right is on the right-hand side of the screen. And I want to look at one thing here. Okay. I'll come back to that other view here in a second. So some changes that we can see on her right, or on her left knee in comparison to her right knee. She does have some swelling inside her knee. Swelling consistent with so on the normal side, you see this nice black triangle. That's considered a normal amount, what we call the fat pad. On the left knee, there's this white appearance in there, and that's just fluid accumulation. The other change that I can see is that her femur is sitting a little further back on the tibial plateau. And that all of those changes are consistent with a ligament rupture. And then as we look at the x-ray of her laying on her back, so here she is laying on her back, her head's up here, here's her pelvis and her back legs. You can see her left side is much more skinny. There's quite a bit of muscle atrophy on that left thigh in comparison to her right. And we also have somewhat of a collapse of the joint compartment. So on the inside of the knee, right? You can see how her joint is much more compressed here than it is on the other side. And that's all consistent with a ligament and probably also a meniscus tear. So the question is, we've got our diagnosis. I will say I want to, this could very well be over-interpretation, but I want to probably monitor her and take another x-ray in another, 2 months or so. Could be over-interpretation, but I want to just follow up on this little circle here. See that little circle in her bone? Mm-hmm. I think it's just a vascular channel, and it's just her normal anatomy, because here's her normal side. She's got a similar circle there. But I just want to keep my eye on that. I'm just mentioning that as an aside. But the treatment for her, we break treatment for ligament rupture into 2 main categories. Medical management versus surgical management. Medical management involves giving her an anti-inflammatory, so the pain medicine, that was prescribed. And I've just got the rest of her records, so I should have an idea of what she's taken. And rest, the pain medicine and rest in 8 weeks, and see whether or not her body can form some scar tissue around that joint to give her comfort enough to where she can cruise around non-painfully. Surgical treatment is still considered the gold standard of care, and the surgery involves placement of a synthetic ligament that recreates that function of her cruciate that's torn. The surgery, honestly, is the easy part. The healing period and the recovery is the hard part. It takes about 12 weeks to heal from something like this. If she were my dog, I would do every attempt to see if we can get her comfortable with medical management first, and then see whether, if she's not getting any better, okay, we can always do surgery. But there's a lot of things to weigh in here as far as surgery versus non-surgery. Age is certainly a consideration, although it is not a disease. The oldest dog I have operated on is about 13, so she's kind of right there. Although toy breed dogs can live up to 16 or sometimes older. But does that all make sense on what's going on in her body?
Mm-hmm.
Bulging disc in the back, and then she tore her ligament in her left knee. I will say there is about a 60 to 70% chance within 6 months to a year we can have the same thing happen on her other knee. And again, the reason why this happens, no fault to y'all's own. This is just an age thing, so if she stepped in a hole or if she was chasing a squirrel, that could be the straw that broke the camel's back. It could have been a motion just as simple as jumping on the couch. So nothing that you could have prevented from happening, because she looks like she's in really good health otherwise. This is just an age-related thing to occur, okay?
Okay. That's good.
So my recommendation right now would be keep her on that pain medicine. And how long has she been limping, would you say?
I think it's been a month and a half.
Month and a half, yeah. Oh, she's sticking her little tongue out. I would keep her on that pain medicine, and I will still provide you with all the literature that describes the surgery and a copy of the quote for surgery. And then maybe we'll try and just decrease her activity a little bit more to only bathroom breaks, and then she comes back in to rest with no jumping on the furniture, okay?
Yeah, she's not jumping on the furniture.
Oh, she's already stopping that? Okay.
We have stairs for her to go up and down. She hasn't been jumping.
Okay.
She has went outside a little bit more lately.
Yeah, okay.
So we'll stop that.
Yeah.
But yeah, she hasn't been.
That's good.
She hasn't wanted to jump up. It's been hurting her, so she doesn't do it. And we have little stairs for her to go up and down.
Okay. That sounds good. Questions?
Can you show me?
Yeah. Let me show you what's going on inside the knee. So this is an illustration of a normal knee right here, where the knee joint anatomically, it's exactly the same as yours and mine.
Mm-hmm.
So inside her knee, we have something called the cranial cruciate ligament. Again, in people, it's an ACL, anterior cruciate ligament. And that ligaments always connect bones to bones. And the ligament is a strap-like band that connects the femur to the tibia. As dogs age, the ligament can weaken over time, resulting in either a partial to a full tear. And what ends up happening when that ligament tears is you have instability in the knee, so that when she walks, I'll bring that up in just a second, the femur and the tibia kind of rock back and forth. And the only time she exhibited pain on her exam is when I focused on that left knee and I attempted what's called cranial drawer, and I could get a little instability in that knee. So that's why she exhibits pain. Very also commonly we'll have the meniscus. This is the cartilage cushion. And I'll show you all of this as well on the model of the knee. But very commonly when the cruciate tears, there also becomes flap tears to the meniscus. So that when she moves, this cartilage will pop forward and pop back and pop forward and pop back. And that just advances discomfort. Here's our knee joint. Side view, front view. Knee cap is here. That's the patella. As we reflect the patella and look on the inside of the joint, the meniscus is this cushion. And in this model, the cruciate ligament is attached. It's this band in the middle of the knee there. But you can appreciate how when that connection is not there,
Yeah, it's kind of.
The femur wants to slide back this way.
Mhm.
Tibia wants to kick that way. Again, you're not alone with this diagnosis. This is the most common cause of a lameness in the back leg of a dog. The area on her body, though, with her back, that she has that bulging disc, is right about here. So if she ever cries or vocalizes, or really yipes with pain, I would say that's the cause. This is more of a cold lameness. At this point, kind of a stiffness when you first get up, and then she should warm into it to a slight degree. But medical management, dogs 30 pounds or less, there is a chance that she could heal this knee just through building in scar tissue to provide her with comfort. But I'll still keep surgery on the table as a possibility for her.
Okay.
And maybe we'll reevaluate that. Maybe I'll have her come back to see me in another month and then see how she's doing. But we keep her on the pain medicine all throughout and kind of go from there, if that makes sense.
What about the disc? Is there anything
That you let heal, yeah. I mean, unless she loses, so the disc would be more of an issue if she's scuffing or dragging her feet. If she's really weak and wobbly in the back end. Horrible disc issues, and this is more of a thing for dachshunds, those wiener dogs. They herniate their discs and they go paralyzed in the back legs.
Ooh.
But I don't think that's gonna be an issue for her, but it's something to watch for. Scuffing, weakness, wobbliness in the back legs.
Okay.
When I say scuffing her feet, I mean like dragging the toes. Does that all make sense?
Mhm.
Yes.
Okay.
Yep.
That's how I think we should probably proceed then, is keep going with the pain medicine for another month and then have her come back to see me for a recheck and follow up.
Okay.
And you can talk amongst yourself as a family too. I'll still give you the literature about her diagnoses, and information about the surgery.
Mm-hmm.
You can talk about amongst yourself as a family to make some decisions on, if you wanted to book a surgery time or not. I think just given her age and the fact that she's showing some slight improvement on the medicine, there's a chance that she won't need it. But the surgery schedule also is booked out probably until about July right now anyway. So just we'll keep that in the back of our mind.
Okay.
Again, her diagnosis is not an emergency. She's got 3 other good legs to get around on.
Yeah, she's been doing pretty good.
Yeah,
I was just going to ask, is there any concern with her being on the pain medication of her actually...
injuring it more.
exacerbating?
I don't think so. I think
Okay.
the ligament's fully torn.
Right.
And again, I tend to be a little obsessive compulsive about looking at all of these little structures and changes. And I do want to, in another month, take one more side view just to monitor and make absolutely certain that this is just a vascular channel and that there's nothing, like the little hole is not getting bigger for any reason, okay? I don't want you to hit the panic button on that, but it's just one other thing in the back of my mind.
Right.
99.9% certain that her ligament is the issue, but there's always these other little things that we start to find when we start looking.
Okay.
So her sedative, she was given a sedative today, allowed us to lay her still for all of her x-rays. It was partially reversed, meaning one part of the drugs can be reversed. The next part, her body's just going to metabolize through. So she's going to be pretty drunk for the rest of the day. So you just kind of take her home. You can offer her food and water, but probably just let her rest and be mindful of that, so that when she goes outside, she may be a little weaker than normal. So you may just carry her out to go to the bathroom and then bring her back in to rest, okay?
Okay.
Yeah.
Okay.
She's got a potty pad in the house.
You got a potty pad? You are very precious.
Yes.
You are a very good girl.
And she's very spoiled.
I believe it. Well,